and welcome to the PLS 5 Administration Scoring and Interpretation webinar. During the presentation, all participants will be in a listen-only mode. If you would like to ask a question during the presentation, please use the chat feature located in the lower left corner of your screen. If you need to reach an operator at any time, you may press *0 if you've joined through the phone lines. As a reminder, this conference is being recorded Thursday, August 30th, 2012. Our speakers for today are Nancy Castilleja and Shannon Wang. Nancy Castilleja is Senior Product Manager at Pearson Assessment. Prior to this role, Nancy was a Senior Research Director at Harcourt Assessment, directing development of preschool assessments PLS 3 and PLS 4, and Spanish assessments PLS 4 Spanish and CELF 4 Spanish. Nancy has experience working with children and adults in community and school settings. She has presented at state and national conferences on the early childhood assessments and bilingual assessment issues. Shannon Wang is a Senior Research Director at Pearson Assessment. She has directed development of assessments for young children, including assessment of literacy and language, CELF Preschool 2 Spanish, and PLS 5 English and Spanish editions. Shannon has presented at state and national conferences on Spanish assessments and literacy. Your first speaker for today is Nancy Castilleja. You may begin.
All right, thank you. Thank all of you for joining us this morning or afternoon, depending on where you are in the country. For the first few minutes, I just want to go over, if you are listening to this webinar after August 30th, there are no CEUs associated with listening to the pre-recorded webinar. But if you're attending live today, you can obtain 0.1 ASHA CEUs. When the webinar is complete, you can download the ASHA CE participant form and evaluation form in the email you received earlier. And you can, if you are attending as a group, definitely print the webinar attendance roster and have all those in attendance sign the form. That form needs to be sent back to us along with the ASHA CE participant form. All right? Let's move on. In accordance with ASHA policies, we need to let you know that both Shannon and I are employed by Pearson Assessment, and Pearson Assessment has developed the PLS 5. So this course will talk exclusively about the PLS 5 and will only cover information that pertains to appropriate use of this test. What we're going to go over is PLS 5 development, and not in great detail, just enough to give you information that you can use to help you better understand the results that you get from the test. We'll talk about key differences between PLS 4 and PLS 5, administration and scoring, and interpretation. There are a lot of questions that we've received from SLPs throughout this past year, and they're embedded throughout the presentation. If you've attended one of our other webinars or listened to earlier PLS 5 webinars, the content of this one is really more focused on responding to questions that examiners have had about PLS 5. The learning outcomes, and this will be on your ASHA CEU form, is we hope that at the end of this you can identify 3 key differences between PLS 4 and PLS 5, describe the difference between start points and age level items, and explain why item placements differ on the 2 tests. So first we'll do a brief overview of PLS 5 development.
So PLS 5 has been out for about a year. We hope that you've had a chance and opportunity to take a look at the test, and what you will notice is that PLS 5 still is a norm-reference test based on 2 scales, the auditory comprehension scale as well as the expressive communication scale. When you administer the 2 scales, you can, in addition to those 2 scale scores, get a total communication scale score as well. In addition, PLS also has some supplemental measures, including an articulation screener that you can get criterion reference scores from. We also have included a language sample checklist as well as a home communication questionnaire that you can use as supplemental materials to double-check their scores and verify the results of the child's communication behaviors.
And even though this articulation screener is criterion referenced, it's based on the normative data collected during standardization. That's what was used to develop the criterion scores.
So one of the questions that clinicians often ask us is, why do we update the test and the test norms? And the reasons are that due to assessment practices, some assessment practices change over the course of time. Populations definitely change. As an example, when PLS 4 was done, that was roughly 10 years ago and such, we had at that time children that came from less diverse populations in terms of the demographic population. There were fewer children from the Hispanic population or Asian population per se, as well as children whose parents did not go to college or did not receive college educations at that time. So the population has changed. Something else that leads us to updating the tests and norms has to do with the children's performance patterns over time. What we mean by that is over the course of these 10 years, early Head Start programs have become rather prevalent, and so we have more and more children attending our early Head Start preschool programs. With that, the performance patterns tend to change, and, for example, more children are have more skills in early literacy at this time than in 10 years ago. Also, legislation and also assessment standards. We look at those, and we abide by those. So what we mean is, while there is no set criteria in the standards for how many years that is that a test should be revised, there are standards that we abide by when we look at, is it time to change a test? So according to the draft of the standards for test revision, it really talks about that when there's new research data or significant changes in domains that are presented that are going to impact negatively on the validity of a test score and the interpretations, then we as test publishers need to be aware of that, cognizant of that, and decide if it is time for a test revision as well as new test norms.
A good example of this would be on some of the items on PLS that show telephones and televisions, especially for really young kids. They would not recognize the PLS 4 telephones as a telephone at this point. So that's a minor change in art, but there really isn't a set amount of time that needs to elapse when a test revision should be done. We get a lot of questions about from people who say, we've heard that once a test is 10 years old, it needs to be revised, and that's really not the case. It really depends on what domains are addressed in the test and how those areas are assessed.
With that said, another question that we get is why were the changes made to the PLS? In other words, how did we know what decisions were made, the information given for the decisions made on what should be changed? So with regard to format and content, our decisions were based on current research at the time as well as best practice guidelines. For example, the roles and responsibilities of speech-language pathologists in early intervention that was published by ASHA in 2008 stipulates that we really need to look at more play-based practices at this time. There's been a big push toward early literacy, so some of those relate to format as well as content. So those were decidedly changes that we made to PLS 5. Directly as to what Nancy was saying earlier in terms of item changes, we get clinicians' feedback. We consider that. We talk about, as Nancy has said, the telephone. Some of the things that we've also talked about that clinicians have given us feedback on has to do with the children don't know money in the same way as they did past, or sometimes we don't want to show a snow item. So those all figure into the types of changes we've made, as well as we also have content and bias. Bias is very important to us, that we try to minimize bias as much as possible. So, for instance, we would have an item, like we said, on money. If children aren't aware of the coins, values, and such, then we would not use an item such as that. The item changes are also made in that we have different research phases, such as pilots, tryout, and then finally standardization. And we look at the data that are collected, and we analyze that data to see if indeed the items show a difference for usability between children who are developing language communication skills normally, versus those children who have been identified as having a communication impairment. And if those items do show a difference, we tend to keep those items, versus if there is no usability, then those items would be dropped.
So moving on to specific questions about test administration and scoring, here's an example of a question we received on our website, speechandlanguage.com. I administered the PLS-4 with the child, then administered PLS-5. The child got the same items right, but the score on PLS-5 is different. And why does that happen? Sorry, I keep clicking on the slide instead of the forward button. I mean, the simplest, most direct answer is PLS-5 is a different test. So although there's an awful lot of overlap with the previous test, about a quarter of the items are new to the PLS-5, and 50% have been modified in some way. So based on examiner feedback, or based on the feedback from our bias reviewers and our content reviewers, we might have changed the administration directions, made them either more detailed or less detailed, changed the number of sub-items within the task and the pass criteria. An example here is this clinician had sent us the record form from PLS-4 and PLS-5, and we looked at those items, and indeed the title of the item was the same, but the sub-items had changed from 4 to 5, and really the pass criteria was stricter on PLS-5, and that accounted for some of the changes in the scores. Also keep in mind that the norms for PLS-4 were collected in 2001, and what we've seen over time with revisions on PLS-3, PLS-4, PLS-5, there's kind of an ebb and flow in the number of children who were enrolled in preschool programs, in pre-K programs, what kind of literacy experiences they've had, and all those changes really affect how kids perform on many of the items on PLS-4, especially at ages 3 and 4 when they're not officially in kindergarten yet. The composition of the two samples are very different also. So the same raw score on PLS-5 will not yield the same standard score as it would have on PLS-4. When we changed the item content, so we got a tremendous amount of feedback from our examiners during testing and from examiners in the field who've used PLS-4 for so long. When you change an item, this changes the difficulty, and it may change the item so much that it moved to a completely different developmental age level. So some of the items did stay in the same place, and I think the items at ages 3 and 4, for example, there weren't significant changes to those items. But overall, there were quite a few changes to the items, and in some cases, the task format changed quite a bit. So when you provide more or less scaffolding or support, or you embed the task in a conversational task, that really makes the item a very different kind of item. We've been asked a lot about determining chronological age. Can I round up? Weren't you able to round up on PLS-4? And I'm testing children who are being tested at age 2-11 to enter school. The rule for both PLS-4 and 5 was that you're not able to round up the child's age, and if you're testing near a norm breaking point, you need to keep in mind that a child whose age is right at the end of an age range is going to score high. because they're being compared to a sample of children who are mostly younger than they are. A child whose age is right above the beginning of that age range is going to score relatively low because they're compared to children who are mostly older than they are. So what we're finding is that, especially at ages 10 to 11, these are children who are transitioning from early childhood programs to school, and clinicians don't have the flexibility to wait until the child is 3. In some areas, they have to be tested before age 3. And what's happening is a child who's that old in the age range is going to be getting a relatively high score. A little bit later, we're going to talk about the PLS 5 norms that we've developed in 1-month increments for children who are 2 years, 6 months through 2 years, 11 months. And we'll talk about that more later in this hour program. We do have people who are confused about the difference between the start points versus the developmental age ranges, and they want to know what's the difference. If you look, and you may have gotten accustomed to this by now, but the bands in purple right here, these show the developmental age range. The items within this band are items that at least 80 to 90% of children at that age pass. The start points, in comparison, are, when we develop PLS 5, rather than asking examiners to move a whole year before the child's chronological age, we actually look to see what an appropriate start point might be for most children. And usually that requires that you just drop back 2 or 3 items rather than an entire age range. So the start points were added during the normative testing phases. Examiners who participated in that testing, for the most part, were very positive about having them, and so we included them in PLS 5.
So, and typically you should have maybe a reduction of 3 to 4 items that you do not have to administer using the start points. One of the things that clinicians have told us too is a hint is, other than the exception of age 0 to 02, so birth or 2 months, what helps them keep the differences in mind is that the start icons are always going to be below, they're going to be found at a taskbar range that is that comes before the actual age of the child,
or the age level that's expected for that child. This is what it looks like in the manual, not with the picture, but. And sorry, I lost my little pointer here. Okay, so the developmental tasks for certain ages are within the bar, and the start points show where you would start testing. This probably wasn't the best example since that's for birth and both are the same, but generally those start points are well below where a child that age should actually be tested. Not be tested. They would be well below the skill level, the developmental age level for that child. And so here's an example of questions that we get that people will ask: why is response to speaker by smiling now at age 6 to 8 months? It used to be at 2 months. And indeed, here's the case of kind of confusing the start point with the developmental task bar. This is the start point. Response to speaker by smiling is the start point for ages 6 to 8 months and 9 to 11 months. But it's actually listed here at the 3 to 5 months level. What we're familiar with on developmental checklists is at the very end of 2 months, children are smiling. And so that is why it's the first item starting at ages 3 to 5, because we looked for the point at which 80 to 90% of kids are exhibiting that behavior. Why are PLS 5 items placed at different age levels than PLS 4? Have children changed that much in 10 years? On PLS-4, the items were placed in a developmental age band where 50 to 90% of children passed the items. So when you look at the top of the age band on PLS-4, usually that first item in the age range, about 90% of children pass that item. When you get down to the third and fourth and maybe fifth items within that age band, about 50 to 60% of children were passing that test item. What we found is that clinicians were talking to parents and telling parents that children should be able to do, that all children are able to do all the activities within that developmental band, and that really was not the case on PLS-4. So when PLS-5 was developed, the decision was made to place items in a developmental age group where 80 to 90% of children pass each item. When that happens, oh, and sorry, I thought it was already going to show. Let me go to the next slide and come back to this one. Okay, when that happens, that shoves some of the test items up to the next developmental age. So as an example here, on PLS-4, you can see that the item sets appear at about the same age range for ages 1 through 111. So has a vocabulary of at least one word. PLS-5 uses at least one word, imitates words. It's at age 2 that you see that there were some items on PLS-4 that where the child needed to be talking on the expressive communication subtest. And on PLS-5, while there are, at age 2, you'll see that really there was only one item where the child is actually using words and naming objects in photographs. And that comes from, let's go back. That comes from changing the criteria where these items were placed. So when you're telling parents, these are the items that a child should be able to do at this age, there is a high probability that most children at that age are doing all those skills. Which leads to another question about why don't some of the PLS 5 items match the other developmental checklists I have. Developmental checklists, tests, and maybe other kind of measures that you might have that show developmental progression might each have their own criterion for mastery. So you might find that, and sorry, I'm looking for my little arrow here. You might find that they either list a range of acquisition, so they might say the child is able to do this skill between 18 to 24 months. Some of them are put together so that the skill is listed at an age where 50% of children pass those items, but 50% do not. Or they might list items at a mastery level where 90% of children pass the items and only 10% do not. You're also going to see a lot of difference in the comparison groups that are used on different tests and on different checklists. So the size and composition of the normative samples are often very different, and the year the research was conducted. In addition, the item content varies. So on some of these different tests, as we mentioned before, when you change item directions, when you change the task in which the item is embedded, that changes the difficulty of the item. So there's no one set difficulty for understands big. It really depends on how you picture it and what the format of the test item is like as far as the item placement. Especially on the expressive communication subtest, there's a lot of concern about the items from 2 years to 2 years, 11 months, because that's probably an area that showed the biggest shift for kids just beginning to talk, and that's the age where kids are being tested to determine whether or not they can obtain services in the schools at age 3.
The other thing that we wanted to talk about is, indeed, there is a large shift because one of the content changes that was added to PLS 5 is that we had a lot of clinician feedback suggesting that we add gestures. By adding gestures and trying to keep the number of items still enough so that you could administer PLS within a reasonable amount of time. Some of those items then shifted downward.
When we collected our data with our normative sample, we found that 64 to 71% of the children we tested at age 2, indeed we're talking quite a bit, using words more than gestures, using words for a variety of pragmatic functions, and using different word combinations. Then what that means is there was still a large number, really a large percentage of typically developing children who were not doing any of those things. And so all those items shifted up from 2.0 to 2.5 to the next age range, which was 2.6 to 2 years 6 months to 2 years 11 months. So in that second half of age 2, the majority of the children in the sample met criterion for these behaviors. Essentially, on PLS 5, for children ages 2 years to 2 years 6 months, they're having to exhibit a lot of expressive communication behaviors, but not necessarily in words. A few items later in the test, on PLS-4 had been what we call transition items, so they were difficult items at a previous age level, and they were now shifted down into the next 6-month age band. And that's the case with quite a few of the items. One of the questions we get is that our age level placements do not match placement from Brown's studies. And certainly when we look at the age of mastery for Brown's developmental milestones, it's based on this research that you see was done, in 64, 73, and 81. There are different demographic characteristics of the sample in 2010. And when we took our PLS-5 sample and looked at a higher SES sample, the performance on PLS tasks very much matches Brown's findings. So those are still very valid data, but that data tends to be collected with higher SES children when it was collected at that time. This is an example of a test item that really moved far from its PLS-4 placement. It uses past tense. This uses past tense item on PLS-4. It used to be done more as a closed sentence task. And some of the feedback we had gotten on that was clinicians wanted to see it embedded in a more authentic task. So on the PLS-5 item, we have the child tell me about things they've done, tell me how you got ready for school in the morning, and this was a much more complex task. So you'll see this is the data that we had collected from children at different ages. Possibly on the original PLS-4 item, it might have been placed at ages 4 or 4.5. And you can see that only 7% of children were able to do this task at age 4. So talk about what they did this morning correctly using past tense. 42% at 4.5. At age 5, that dropped, which is consistent with developmental milestones where kids switch to, regularizing irregular verbs. But by ages 5.5 and 7, children were able to do this really consistently. So that test item actually moves pretty far up developmentally, even though that doesn't mean that children are unable to use past tense earlier, but using past tense consistently in a conversational task was much more difficult for them. We have a lot of questions about determining if PLS-5 is appropriate for diverse populations. Really, you're the one who knows your population well. If you have a population that, if you have children who are older, who've been in school for a while, who've been exposed to school curriculum, if you have a very diverse population, though, that has essentially had very similar experiences to the experiences that are depicted in PLS, you're going to find that they find those contexts very familiar and are able to do those tests really quite well. one of the comments that we get from clinicians who participate in our studies is that they're surprised to see how well and how quickly and how easily typically developing children breeze through the tasks and understand the context within those tasks. But certainly, you know the children that you're testing. If you're working with a child who's had very limited school experiences, who comes from a background where it's not appropriate for that child to converse with adults, or has had very few pre-literacy experiences, then you certainly want to look at other forms of assessment to appropriately determine whether that child has a language disorder. We do go through a lot of steps to minimize bias for different groups. And a lot of times when we go to sessions and we listen to people talk about how this is done in tests, matching the sample to census figures is really only one part of the many things that are done to evaluate the test for bias. So we have content and bias review. We work with individuals who have a lot of expertise in assessment, who publish in this area, who talk about diversity, to review the content of the items, to flag items that could possibly be problematic. We do have individuals whose expertise is specifically on bias issues, review those items. And in addition to their feedback, we collect additional cases over and above those that are part of the census targets to do a large study looking at to see if there's differential responses to our test items based on certain characteristics. So to determine whether if you're a child from a low SES background, are you going to respond differently than a child from a high SES background? If you're a child who is Hispanic or African American, are you going to respond differently than a child who is not? We do go through multiple research phases, and we test throughout the United States at many, many sites. So it certainly doesn't cover all children. Every child who comes through your door is a unique individual. So I'd also question whether there is such a thing left as a mainstream child. So as you look at the content of the test, really you're the best judge of whether the content of the test really is appropriate for the child that you're testing. In case you haven't looked at your manual, because some people don't, you may not have seen that we have a more expanded appendix of dialectal variations that are considered appropriate for children who speak a dialect other than mainstream American English. So they got much more detail than we could place along with the description of the item in the record form or in the administration and scoring manual. So you'll find that information in the appendix. But certainly if a child is speaking a dialect other than mainstream American English, you are able to score that response correct if it's consistent with the rules that would be followed in that dialect. Do you want me to continue? Okay, interpretation questions. We've had a lot of questions about the ability to qualify a child for services based on the auditory or expressive score alone. And indeed, each of these scores are norm reference scores. You can qualify a child for services using, if the child has a deficit only as indicated by his results on the auditory comprehension subtest, you can use that score to qualify a child for services. You don't have to use just the total language score for that purpose.
And as you can see on the record form, that's what we've done. There should be at the top grid, what you should see is you should see a space to capture standard scores for auditory comprehension. You should see a grid that you can capture just the expressive communication standard score or the combined score.
This is a question I know that certainly has come up in the listservs, and we talk to a lot of people at conferences. Why are the PLS 5 scores so much higher? Oh, here's one of the typos we had taken care of. Shannon didn't upload this. Sorry. Why are the PLS 5 scores so much higher than PLS 4? When we did our study, the mean difference in scores between PLS 4 and PLS 5 were actually very small. That being said, so overall across your whole population, you shouldn't expect to see huge differences in scores. But that being said, we know that individual children did have quite a bit of variability in how they performed. Some higher on PLS 5, some actually lower. We've worked with several people around the country who sent us children's protocols showing us the scores on both tests. Both tests were administered at the same time. We found a couple of things that you might check in your records. One of the things we found is that sometimes they were scored incorrectly. So the pass criteria for PLS 4 was also applied to PLS 5 just out of habit. Other times the wrong score was looked up. So that's the first thing to check. But in addition, you have certain children who have certain patterns of performance that now that we're looking more at literacy skills or looking more at different concept skills at different ages, the children may or may not have known those or had those skills intact on one test or the other, and you get a larger discrepancy in the scores. What you should expect to see over time, because as we worked with these individuals, with the children on their caseload, is that some kids did score higher on PLS 5. Sometimes they scored lower. On average, you should see 1 to 2 point differences, and that's certainly an important difference if a child was borderline before, and now the 1 point difference or the 2 point differences put him right above your district's criteria for placement.
With that said, however, there is high decision consistency across the two scores of PLS 5 and PLS 4, meaning that if a child scored relatively low in receptive language on PLS 4, you will see that that same child will score low on PLS 5 as well. If they have a total language score that is high in both cases, you would not expect to see a significant dip at that time.
One of the things that contribute to a different PLS 5 score, especially if you used PLS 4 when the child first started therapy and now the child has gone through a number of months of therapy, you need to look at the additional skills that the child may have acquired. Depending on the age and ability of the child, if he masters one more developmental language skill at age 18 months, that could result in a 3 or 4 standard score point increase. If you look at ages 3 to 5, that kind of change could result in a 2 to 3 standard score point increase. You might also want to look at where the child's chronological age was in the 6-month normative band when they were tested each time. So was he at the top of the age range or the bottom of the age range? Because that also is going to result in some shift. If you used PLS 4 and the child was at the bottom of the normative age range, he's going to look relatively low compared to peers. And then if you use PLS 5 and he's at the end of the 6-month age range, he's going to look relatively high. So time of testing is going to be important. What we usually see happen, though, is that the child may be weak in one specific language area. PLS 5, like PLS 4 and PLS 3 before it, was really developed as an overall developmental look at language. So if a child is poor in one particular area, there's not a lot of test items tapping that particular skill at different ages. And it may be that you need to look at a different kind of assessment or a different standardized assessment that does a deep dive into a specific area. So, for example, if the child overall has great interactive communication, pre-literacy skills are great, concept development seems okay, and morphosyntax is poor, his PLS 5 score is going to come out somewhat low. I'm still looking for my arrow here. So you can see that certainly for emerging skills with little ones, you have a lot of distribution of kinds of items across different skills, but not tons of depth within any one area. There are a lot of items on PLS 5 for the older children, and this was based on clinicians' feedback that looks at the integrative language skills and emerging literacy. Not as much of a deep dive at all in morphosyntax, either on the expressive or receptive side of the test. One of the things that we decided to do is to place 1 month norms for ages 2-6 through 2-11. It's available on the website if you go to the PLS 5 product page. So if you Google PLS 5 and go to the PLS 5 product page and go to resources, you'll find a list of norms by month for ages 2-6, 2-7, 2-8, 2-9, 2-10, and 2-11. And this will enable you to compare children to other children instead of across a 6-month span for that critical age range, to look at other children within compared to 1 month age groups. That's available in English and in Spanish. And we wanted to show you what this looks like when you would use 1 month norms. So if you're using the PLS 5 and the child gets a raw score of 26, and you're using the 2-6 to 2-11 norm interval, that child would get a 76 with this raw score. This shows what his standard scores would look like using the 1 month norms at each month age. So you can see if you're testing primarily kids who are 2-10 and 2-11, and your cutoff is 76 or below, these children would qualify for services. That being said, the scores for the youngest children at that age would bump up higher. So the 76 was an average score that would have been in here for children 2-6 to 2-11. And depending on the feedback that we get from you all, if you decide to use these, we'll look at expanding that beyond this age range. There's also some information about how these scores were developed, and to let you know that, sorry, let me go to the next. No, that's not in here. But that if you use the 1 month norms, you need to use them consistently with that age group. So if you're testing children 2-6 to 2-11, and you choose to use the 1 month norms or the norms in 1 month increments, you should do that for all your 2-6 to 2 years, 11 months old children that are referred to you.
Okay. So one of the next questions that clinicians ask us often is, the child I tested had a much higher score on EC than on AC. So why does this happen, and how can a child express more than he or she understands? And actually, the answer to that is that we know that children's communication, when we look at it, there is a lot of overlap between what a child understands and what a child can express. When we are providing the two scores to tease them apart, we are really doing it in terms of relative weakness and relative strength. And looking at those that is how we derive the two scores, the AC and the EC. Keep in mind, the reason that one score can be higher than the other one is that the items may be different. So while AC and EC in terms of language understanding and language expression are related to one another, the way we test it for those items, specific items, may pull one area of strength more than the other one. So when we take a look at them, at our sample, we found that there was really about a 3 to 4% of our sample that showed no difference between the scores, but it was much more common that there was a difference between the scores, with roughly 47% of the sample showing a little higher score on the AC and another 49 to 50% per se that showed a higher EC score. Now, what we would say is the point difference is when there was a difference of at least 1 point, there was about 48% of the sample showed that, and where there is a 5-point difference, roughly 31% of our sample shows that. So what does that all mean? Is 5% difference significant, or is it not? And the answer is what we can do is dependent upon the age is how you decide whether it's significant or not, and for your population. New to PLS 5, you can calculate the difference between the AC score versus the EC score, and then through a series of procedures decide if that score is significantly different, and if it's so, based on prevalence, what does that mean for clinical use? So a question that follows from that is, based on the AC and EC discrepancy comparison, is what is statistically significant? One of the things that we look at is score point differences in general that are less than 7 points were not found to be significant, meaning that at a 0.15 level of significance, many children that are typically developing will show that 7-point difference between AC and EC, whether it's that AC scores are higher or whether that EC scores are higher. It's typical to see that age range difference. As we said, that's pretty standard, but again, it is based on that age population as well. So you'll have to go through the steps that are outlined in the manual to find whether it's significant for your age population.
We're starting to get this question a lot, I think, as children are being assessed more frequently or are being sent for outside assessment as a second opinion when PLS is given the first time. You're not going to find, we don't do studies to determine an optimal test-retest interval time. The test-retest studies that we do are to look at stability of scores, and so those test-retest times are very short. They're 2 days to 14 days. That being said, there are some general guidelines we tell people to follow when they're determining whether or not they should re-administer PLS after a short time. You need to ask yourself if enough time has elapsed that the child does not remember his or her responses to the test items from the prior administration. What we do know from our test-retest studies is that children always do a little better the second time when it's re-administered, when the test is re-administered between 2 days to 2 weeks later. They might remember their responses, they might be a little bit more comfortable, but there usually is a small increase in scores on the second administration. You need to determine if enough time has elapsed that the child's chronological age now places him in the next normative group. So generally we would think of that as then has at least 6 months elapsed, but as we just mentioned before, it might be the child was tested when he was 2 years, 10 months, so waiting till he's 3 years, 1 day old might be a little soon for him. And the third one is, has enough time elapsed that the child has made progress? Because if not, there's really not another good reason to reevaluate the child. If the answer to any of those questions is no, you should not re-administer PLS 5. But again, those are just guidelines to follow. It's not set in stone. One of the things we wanted to wrap up with before we go to some of the questions that have been submitted is that what you hear at every session about assessment, that you should not use a single score. It is inappropriate to use a single test score to determine eligibility. And so you need to, if you're in a school district or in a setting that's requiring that, you need to be able to appropriately document all the other assessment information that you've gathered. And you look at the results of all of these things to determine where is the preponderance of evidence about this child. Is this a normal language learner, or does the evidence support speech and language disability categorization? We had done an ASHA presentation with several other colleagues a few years ago and talked about how you need to kind of evaluate where does most of the evidence lie and how do you work that into your interpretation. So if you have a borderline PLS 5 score, you should be able to use the information you have from your developmental history, parent interviews, and you don't have to give each of these things, but from the different kinds of assessment information you collect, you should be able to make a case for either inclusion in special services or not. This was just another example where the score on PLS might be borderline, but really most of the other evidence obtained in this situation would suggest normal language acquisition rather than disability. We do have a couple of minutes, and I'm going to...
We do have a couple of minutes for questions, and there is a question.
Oh, I'm sorry, there was...
No, go ahead.
No, I was just going to say, if we don't get to your question today, you can submit questions to speechandlanguage.com in our blogs, and we can talk to the author about a response to your question, and we can post that on our website.
Okay, we do have time for a couple of questions, and one of the questions that was asked is why we can't round up a child's chronological age if it's known that a child at 211 is going to score high, but then could score significantly lower 1 month later at 3.0. That's a great question that we often get. The response to that is that we ask that a clinician does not round up the age. So if a child is 211 to round that up to 3 years of age, because when we collected the data, which our norms are based, we did collect so that that age range, and for those tasks that are normed based on that, we did not have any of the children's ages rounded up. So a child that was 2 years, 11 months, and 12 days still is captured as data as a child who is 2 years, 11 months.
So the scores are based on not rounding up.
That's correct.
And so the reason we went through the little exercise of talking about how kids will tend to score, that's part of your interpretation of your PLS 5 results. Now, if you're testing 2-year-olds, 2.5-year-olds, because there are a lot of people needing to be able to test kids from 2.6 to 2.11 and are not being given the leeway to wait a week to test that child again at age 3, then part of your interpretation of those test scores and those test results is to explain that one of the reasons this child's score is somewhat high is that he was tested at the very end of his age range, and if he were to be evaluated again in a few weeks, that the child would score much differently.
So again, if you're testing a child in the 2.6 to 2.11 age range, you might then find it useful and helpful to use the norms that were developed at 1 month increments. But again, if you choose to do that, you need to do that with all the children that you test that are 2.6 to 2.11.
We had another question about, do you think the visuals aid in comprehension and can make a difference? Definitely how not only the visual stimuli, but how the directions are worded to the child and how much we say to the child all affects how the child responds to the test item. That's why there's so much emphasis on administering the task as shown in the record form and not rewording tasks or not rewording the directions or elaborating on the directions. Sometimes we think by providing the child with more information that we're helping them, and in our research studies, we find that as we vary those directions to the child, sometimes it does. Additional information does help, and so we have some test items that we added practice items to, and those worked out very well. Other times we found that adding practice items or adding additional explanation actually confused more kids than helped them. And each of those parts and pieces does make a difference in how the child would score on both on the expressive and receptive side of the test.
Okay. I think there's another question that's been asked about are responses expected to be grammatically correct? And the answer to that question is it depends. So when we're testing items that are related to vocabulary and word development, the answer is grammaticality in those responses is not counted or not considered. It is just strictly the vocabulary and the word usage that is considered to be correct or not. However, there are items that are targeted for morphology and syntax, and in those cases, correct grammar does apply and are counted as correct or incorrect. For very specific scoring of each of those items, you can refer to your administration manual in the administration and scoring chapter, which I believe is chapter 2, and each item will tell you whether you need to consider correct grammar for that response.
This is interesting. A person said in a comment that some of the psychologists where she works, if there's a significant difference between AC and EC in favor of the expressive, it can be related to a child presenting with decreased attention span. And I would say sometimes, but not always. As we pointed out earlier, that a lot of children have higher EC scores than AC, and we're not matching the tasks exactly. What we're testing on the auditory side of the test are not necessarily parallel tasks tested on the expressive side of the house. So if we had those perfectly matched, that would be easier to tease out, but really we're usually testing a different set of skills on the expressive side than the receptive. When we look at test items, we select the test items that best discriminate between groups of typically developing children and children identified with a language disorder. And so we don't necessarily have a parallel task of understands basic concepts, expresses basic concepts, understands morphosyntax markers, expressive morphosyntax markers. So that could account for the difference with some children. A decreased attention span could account for those differences, but not necessarily. And it probably has more to do with the content of the test unless it's clear that the child has attention deficits.
There has been a few questions concerning the populations that we can use PLS with and still get norm scores. What we can say is children who have a hearing impairment or children with autism where you would necessarily have to use a PEC system of some sort, communication system of some sort, please go ahead and feel free to give the PLS to see how the children would do. However, because those children were not included in the sample, at this point, you would not be able to use the norm-based scores with those children.
And we do have some more questions. I'm sorry we're running out of time to answer them, but if you'll submit those to speechandlanguage.com/our-blogs, we will answer those and post them on the website. I do need to go over with you to receive if you're listening into the live presentation, to receive your ASHA CEUs, go to speechandlanguage.com/registration_info. You need to download the forms, submit the forms they must be postmarked by Friday, September 14th, 2012. We do not accept forms after that date because we submit them to ASHA after that time. If you're meeting in a group, please have all the members of the group complete the attendance roster. Only the people on the attendance roster who are signed up with ASHA's CEU, who are signed up to obtain ASHA CEUs will be submitted to ASHA to receive those. If you have any additional questions, later, certainly send those to us, and we'll be glad to post those on the website. Thank you for joining us today.